Hello.
Hello, friends. All right. Time to learn how to keep your staff alive, your artists working, and generally make mankind your business, which most likely you shout at your audience every November and December. Don't care about people? No worries. Not everyone's thing. Let's talk about money.
Show me the money!
Substance use conditions, SUC, will cost our healthcare system and economy more than $400 billion this year. Yes, that is a B, and it's an annual cost. Guess who pays that? You. Turnover, absenteeism, loss of productivity, and healthcare expenditures are all things you're paying for.
So what do we do?
By creating a recovery-friendly workplace, we can fight the stigma associated with the disease of addiction and encourage employees to get help sooner. We'd all rather have stage 1 cancer than stage 4, so the game is the same. Education, early detection, options, conversation, community support. Create a workplace where you don't have to get to the dramatic point of intervention.
A what?
Substance use condition occurs when the recurrent use of alcohol and/or drugs causes significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, and home.
SUC is a chronic disease that does not discriminate based on socioeconomic status, gender, age, or race, and it's more common than you think.
According to the National Survey on Drug Use and Health, there are more than 20 million people in the United States who are affected by substance use condition. This means that 1 in 3 households are directly impacted by this disease.
So if there's 3 of you watching this, apologies to the 1 of you that's already going through it.
Contrary to what some may think, addiction is not a moral failing or lack of willpower. Addiction is a chronic, relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. It is considered a brain disorder because it involves functional changes to brain circuits involved in reward, stress, and self-control. These changes may last a long time after a person has stopped taking drugs.
While the initial decision to use a drug is usually voluntary, the brain may be altered over time, sometimes immediately, and the decision to use no longer becomes a choice.
No one factor can predict if a person will become addicted to drugs. A combination of factors influences risk for addiction. The more risk factors a person has, the greater the chance that taking drugs can lead to addiction. For example, there are 3 main risk factors that influence the likelihood of addiction. Genetics. The National Institute on Drug Abuse states that genetics account for between 40 and 60% of a person's risk of addiction. Environmental. Family, school, home life, the presence of other mental disorders, peer pressure, and early exposure to substances can all influence the risk of addiction. Developmental. Studies show that the earlier in life drug use begins, the more likely it will progress to addiction. Recovery is possible. The good news is that addiction is a treatable and manageable disease. As with other chronic diseases such as HIV, diabetes, asthma, or heart disease, SUC treatments should be ongoing and frequently assessed. It's important to note that there are multiple pathways to recovery. Every individual is unique, and there is no one-size-fits-all recovery program that will work for everyone.
People do not need to hit rock bottom before they receive help. Peer recovery coaching brings services upstream and helps people who are still employed live at home with their families and have supportive relationships. Coaching services can also be used before, during, after, or in lieu of treatment.
There are an estimated 23 million Americans in recovery who are creating healthy lifestyles, relationships, and communities. And not all of them jog, take care of plants, or post inspirational memes constantly, though stereotypes do exist for a reason.
Woman's Instagram.
What should you do if you suspect substance misuse in your workplace? Well, the signs aren't always easy to detect. Here are some troubling behaviors that may, but not always, indicate substance misuse.
Increased absenteeism, both unexpected leave and excessive use of vacation or sick days. Frequent and unexplained disappearance from office or worksite. Poor and or inconsistent job performance. Increased accidents both on the job and at home. Difficulty or lack of concentration. Increased errors and poor judgment and decision making. A decline in physical appearance and hygiene.
Basically, if they look like they're in Tech Week, but it's not Tech Week, you should clock it. It's important for employees to know what actions to take if they suspect or observe substance misuse in the workplace. Employees should notify their supervisor or HR representative if they notice a coworker exhibiting troubling behaviors. A swift, recovery-oriented, employee-friendly response increases the chances of the situation being properly addressed.
Employers should approach conversations about substance use condition with caution and care. There should be legitimate, reasonable, and documented observations that initiate the conversation.
Write it down.
Keep it performance-focused while giving them an opportunity to elaborate on why. Consider having a fellow employee in recovery join.
If you just said to yourself, we don't have anyone in recovery, then ask your staff. They know. I promise you, some of your admin staff is at least an Al-Anon. People who dedicate a career to bringing order to chaos for the good of the family. See, you already know them.
Don't ignore the signs, jump to conclusions, make accusations, or assume you know what's going on. Do observe, document, listen, offer help. Language matters. Instead of addict, junkie, or druggie, say persons with substance use condition. Instead of abuse, say misuse. Instead of dirty, say actively using. Instead of clean, say in recovery or substance free.
Denial of the issue can't occur.
Me? I don't have a problem.
Oh, okay. Denial.
In this case, employees should move forward with standard procedures to address performance-related issues or inappropriate behavior. Clear expectations and consequences should be set. Any and all disciplinary action needs to be based on the performance, conduct, and adherence to workplace policies. They cannot be based on the suspicion of a potential substance use condition.
Don't be suspicious. Don't be suspicious. Don't be suspicious. Don't be suspicious.
And reminder to them that if they do want to get help, the organization is ready. If they say they need help, hey, congrats. You accomplished something huge. Imagine if an employee told you they had cancer. You'd quickly create an employee-centered plan to help. Do that here. If they need to leave work for a time to get significant help, collaborate on a return-to-work plan after treatment. Eliminate concerns over losing their position. For guest artists, this may just mean you're game to work with them again in the future. So what do lawyers say about all this? There's two sets of federal laws that may pertain to someone with substance use condition in the workplace. The Americans with Disabilities Act prevents an employer from discriminating against an employee simply for having a disability, disease, or medical condition, such as substance use condition.
Current alcohol or illegal drug use is not protected, but those in recovery or treatment are covered by the ADA.
Family Medical Leave Act legally ensures that employees are able to take unpaid leave for serious medical conditions, including treatment for substance use condition.
Covered employees can take job-protected leave for a total of 12 work weeks in any 12-month time period for treatment that is administered by a healthcare provider or as a referral from a healthcare provider.
You can get fired for using while on the job. You cannot get fired or discriminated against for being in recovery. And once again, the main goal is to create an environment where people feel comfortable asking for help early on, and they know you will provide them with options for care. So we never get to the can we fire them part.
Do not go in there.
So what is this Narcan I hear about all the time? Naloxone is a medicine that rapidly reverses the effects of an opioid overdose. There is no side effect from giving it to someone not having an overdose. 77% of overdoses last year could have been reversed with Narcan. Yep, 77% of the people who died didn't have to. Get Naloxone Now is an online resource for training people to respond effectively to an opioid overdose emergency. Employers can consider having naloxone at their workplace or other trainings to employees on how to save lives.
You're now more likely to die from an opioid overdose than from a car accident. Think about it. If you're handing out COVID tests to every guest artist, you can hand out some Narcan too.
Great, this all sounds lovely, but on a day-to-day basis, what can we do? Well, first and foremost, have non-alcoholic options at company events, especially galas and donor events, which require a high level of charm. Have a place where recovery isn't a dirty word. Talk about it. Be open to it. Stigma shames, and shame kills people faster than anything. Remind your staff that addiction is not a moral failing, it's a disease. We all love to talk about how art creates empathy and conversation in our audience, so let's do that for ourselves. For other recommendations and best practices that are currently happening around the world, follow the QR code. We'll update it with great examples of what we hear about.
Question?
Someone is struggling. Does their insurance cover it? Most insurances do. Go to samhas.gov and click on Find Support.
Question?
I don't have insurance. Am I dead in America? Nope. You can also look at that link and click on How to Pay for Treatment. There are low and no-cost options. An artist who made more than $6,500 last year can apply through the Entertainment Community Fund. Let's wrap it up. Ideally, we make a recovery-friendly workplace that is stigma-free, so we don't get here. If you had a peanut allergy, you'd speak up, and we'd all be totally respectful. That's the goal. Tackle addiction the way we have tackled peanut allergies. The difference between the two? We all agree a peanut allergy isn't a moral failing. So let's do the same for addiction. We have to remove workplace shame and stigma so we can actually get people to ask for help.
Okay, now cue the music and that star thing.
They're gonna see that recovery is possible. Artistic